Hi, my name is Amy Hoying and I'm a physical therapist here at the Institute for Orthopedic Surgery. And here are the exercises for a total hip replacement. I would really highly recommend that you practice these exercises prior to having your surgery, no matter how many days you have before having to come back, because it has been proven time and time again that the stronger you are coming back in and the more range of motion you have coming in, the better your recovery is. So I really highly recommend that you practice these before coming back. First exercise is what we call a quad set. The quad is the top thigh muscle. It is done by tightening the muscle on the top of your leg by trying to force your knee down. You'll see the muscle, the kneecap try to come up. You hold the contraction about 5-10 seconds and then relax and then repeat and then relax. Good. The next exercise is going to be the glute set. That is going to be squeezing your buttocks together, holding it once again for 5 to 10 seconds and then relaxing. And you're going to do both of these exercises for approximately 10 repetitions. The next exercise is called an ankle pump. You do this with both sides, and this is to help prevent blood clots. We want to make sure that you're keeping the blood flowing through the lower leg so that it doesn't sit still and clot. So this is your way of helping prevent those blood clots. Those three first exercises are going to be asked to be done every hour once you're in the hospital after your surgery. The next exercise is called a heel slide. You're going to slide your heel up towards your buttock, trying to bend the knee as far as you can. You're going to hold at the end for at least 10 seconds. Then you're going to let it back down. Now remember, when you get to the end, you may feel a little bit of pain, okay? What's happening is you are stretching the muscle, and the muscle has been cut through and it's not very happy. But remember, you are not injuring anything by doing this, okay? The muscles are letting you know that they're being stretched, but there is no injury happening to the device. Hold and then back down. Very good. The next exercise in the picture shows a ball that we put underneath the knee. You don't necessarily have to have a ball. You can roll up a blanket, towel. What we want is the knee to be bent at about a 45-degree angle. And the instruction is going to be to lift the heel up and try to straighten the knee as far as you can. Hold it and then lower it back down. You're tightening the top thigh muscle once again. Very good. You will need a walker for after your surgery. We prefer that you have one with standard legs. If you do have one that only have wheels, you can bring it with you and we will let you know when you are able to transfer to that safely. To make sure the one that you have is going to fit you, you have to stand in the walker with your arms down to your side, and the handles have to come to your wrist bones. If it does not, then you just have to go down to the end and bring the legs up or down. This one fits him perfectly. You will be weight bearing as tolerated after your surgery. What this means is you can put as much weight as your pain allows on your surgical leg. In order to walk, you will use this sequence. You want to place the walker out in front of you by just straightening your elbows and placing the walker down, all 4 legs down at the same time. You're then going to take a step with your surgical leg first, put the weight through your hands, and then take a step with your non-surgical leg. Place the walker, surgical, non-surgical. Each time you take a step, you're going to gauge how much weight goes through that leg. While you're here at the Institute for Orthopedic Surgery, one of the jobs of the physical therapist is to test whether you are safe to go up and down stairs. Before you come to have your surgery, please evaluate your home and how to get in and out and how many steps you have and whether there is a railing. And please tell your therapist what that is so that we can determine whether it is safe for you to go home. Most people stay here at the overnight care unit for about 2 to 3 days. What that means is if you have surgery on Monday, you will stay here Tuesday and then go home Wednesday for a 2-night stay, and then Thursday for a 3-night stay. You will need to do therapy once you leave here in 3 different ways. One way may be that you go to a skilled nursing facility. What this means is that we may determine that you cannot get up the steps to get into your home. You may need too much help to get out of a chair, get into bed, or just walk around your house, so you need further nursing and therapy care. Both hospitals here in Lima have transitional care and/or rehab facilities in which you could go, and most of the outlying nursing homes have short-term stay, physical therapy every day places. The only thing you would need to do is to provide transportation to these locations. A second option is you may do home health. In this option, we determine that you are homebound, in which we feel that you will not be able to get out of your house and go to an outpatient facility. We make the first appointment for your home health, and a nurse and a physical therapist will come and evaluate you and determine what your needs are. The third option, you will do an outpatient physical therapy, in which you can do at any facility in the area. We will make the first appointment for you also, and then you make further appointments after that. Please be aware that you will not be able to drive yourself to outpatient therapy. Your physician will be able to release you to drive. Please remember that this is a marathon, not a sprint, meaning your recovery is going to take a long time. Some people will take up to a year for a full recovery. So make sure you do your exercises every day, and call if you have any questions at all. Thank you.